Hi, everyone. Welcome to Beacons of Balance. I'm Arlene. This is my wonderful co-host, Joanne, and this is
Oh,
our wonderful guest speaker, Dr. Deborah King. So,
wow.
question for everyone. What would you do if you're with somebody in your house, away or whatever, and someone has a heart attack? They're holding their chest. What would you do? Well, listen to this episode because you're going to find out things you don't know. And it's going to be an educational piece today. Very, very important. And we're so happy that Dr. Deborah King is here, that had her
Yes.
own experience. And
Mm,
he's a PhD psychotherapist, right? Psychotherapy. And
mhm.
was a nurse also, practitioner. So, Joanne, let's begin.
Wow. Well, welcome, Deb. It's an honor to have
Thank
you
you so
here. And
much for
we're going to learn
having me.
so much. And this is a really important topic.
Absolutely.
One thing that blew my socks off, I have to tell you, because I was doing some research as well, is that cardiovascular disease is the biggest killer of women. Here, I thought it
Abs
was breast cancer. And it's
absolutely.
like, oh my
Yes.
God. And it's like, what are
Yes.
so can you give us some of the risk factors? Because this is really important.
Yes. Yeah, I think, Joanne, this is a great place to start. And so, when I first became licensed as a registered nurse back in, the 70s, we were not as aware as we are now about uh, how much of a killer cardiovascular disease is for women. And most women fear cancer, right? Especially
Yeah.
breast cancer.
Mhm.
And one of the most important takeaways, if you remember nothing else from today, is that in this country in particular, although globally it matches pretty closely, women are much more likely to die of cardiovascular disease than all types of cancer combined.
That's
All
amazing.
types of cancer combined. And that comes right from the American Heart Association, which is
Mm,
where most of my information from today's talk will come from.
right.
And this is an important topic for me because you ask about risk factors. And I'll talk later about my own cardiac event, from which or before which I really had no traditional risk factors or things that women or anybody think of when they think of, oh, gee, he or she is at risk for a heart attack. Before I talk about risk factors, let me just quickly define what heart disease is. Okay. If this is the number one killer of women, what is it? Well, you might think that most people know what that is, but we know some of it. People think of a heart attack or they think of
Mm,
hardening of the arteries, blockages to the heart. This is all part of it. But the thing that people do not think of which are can be just as dangerous, are hypertension. How many patients said to me over the years, "Oh well," and I'd say your blood pressure is high, and they'd say, "Oh well, at least I don't have heart disease." So
mm.
hypertension is heart disease. It's cardiovascular disease. So this is a silent killer and the number one leading cause of stroke in women. Rhythm disturbances are another thing that we don't think enough about, and they can happen to children, teenagers, women, men of any age, any gender, and I'll mention those a little bit. The other thing that we can think about are heart valve problems. Sometimes women have valve problems that they might notice are there during a physical, like a mitral valve prolapse, for example. I'm using that as an example because I have that. But I was told for years, this is a normal variant, Deb. This will not cause you any problems. So there are a lot of things that can come into it. Heart failure, not just a heart attack, and it's not just always the big things. So hypertension is really for me at the top of the list because the good news with hypertension with many of these things is that it may be the largest killer of women, but we have many areas where we can have control over the risk factors. So, what are the risk factors? So, certainly genetics always will play a role. I think for women, the things that we have to think about are things like, we're caregivers, right? And that's one of
Right.
my big messages today. We care for everybody except ourselves often. We're not
Mhm.
really great. I know I'll speak for myself and for many of the female patients I cared for, both as a nurse and as a therapist over the years. We're worried about our families. We're worried about our loved ones, right?
Yeah.
Arlene, we're worried about, our spouses.
Yep.
And at the end of the day, we're pouring from an empty cup, which really is a big part of my story. So, stress and lifestyle management, I mean, we all know about the keys, exercising regularly and, maintaining as healthy a lifestyle, low animal fats, plant based diet, all these things that on any given day we may or may not be good about doing, but those are, they're in there, but they're not the only thing. Stress management, sleep, we're finding out. People who don't sleep have high quality sleep, at least 7 to 8 hours a night. Now, wow. Okay. All right. So, and what do we know? We know that the cardiovascular system needs to rest and restore itself in a
Mhm.
high quality way. So, sleep is extremely important. The other thing that comes into play for women are hormone therapies. Okay, so there are some risk factors associated with, for example, postmenopausal women who may be on hormone replacement therapy, and for younger women who may be on certain types of hormonally based contraception. Uh, Maybe not in and of itself, because they're certainly a lot safer than they were many years ago, but if you added that factor in with other risk factors, then they become cumulative. So, for example, you might have a young woman who may have a genetic predisposition. She may be on a very safe and low dose contraception or contraceptive medication, but she may also be hypertensive. She may be a woman of color. We know that women of color are 2 to 3 times at more risk for cardiovascular disease simply because
Um,
of their genetic risk factors. So, those are some of the big ones to keep in mind. And I mentioned blood pressure. And if I forget to say it anywhere else today, I really am a strong believer in investing in some, small things that are great for self care and knowledge of our own health. And measuring one's blood pressure at home is one of those things. You might go into your pharmacy or into a store where you sit down or check your blood pressure. Okay,
mhm.
that's better than nothing. But, people are using those machines all day, right? They get rattled around, they're not calibrated. So the best way is to invest in a machine that, I mean, you can certainly buy good ones on Amazon. You can do some research about some of the ones that are better than others. And check your own blood pressure at the same time, in the same position, in the same location in your house, keep as many variables constant as possible and just get an idea of what your baseline is. So when you go to your healthcare provider and your blood pressure is elevated, say your baseline at home is, 120 over 70, which would be a great blood pressure, and you go in to see your healthcare provider and it's like 144 over 92 and somebody's whipping out the prescription pad. You can say, you know what? I get a little bit nervous when I come in to see a healthcare provider. This is my diary of my medication, of my blood pressures rather at home. There are apps. I have one that you can just enter them into your phone and have them with you at all times. And, this may be more important if you're older or if you have other risk factors, but I'm a firm believer in taking control over as much as you can control, as we can control as women and as individuals, not just women, but so that we're in a position of power. And information about your own health, what your baseline blood pressure is. It will also measure your pulse, most of the machines. And so that's a provider loves that. A good provider will say, wow, give me that data. Because if you have white coat hypertension, meaning when you see that white coat coming, the blood pressure goes up, which is very common.
Mhm.
it's important to know that that's a function of, your cardiovascular system is excited and a little bit nervous, like, "Ooh, what am I doing here?" So, that's great information for you to have.
I was nervous, actually, I'm gonna say I just had a back surgery, and when I went in, the person next to me on the curtain was having another type of surgery, but his pressure was so high, they wouldn't operate, they sent him home. So, of course, now I get nervous, they come over to me. Mine was 187 over, but it was 74, and I go, "Oh my god," I go, "Don't send me home." Oh my wait, I go, "No." And they go, "Oh,
Okay.
pick on me. Oh, you alright." Like this, and I go, "Wait a minute, that's kinda high."
Well, and it's a common problem. I mean, my own son recently went for a root canal, just a root canal. Now, that's enough to get anybody's blood pressure up, right? If you've ever had root
For
canal.
sure.
And his was so high they wouldn't do the procedure.
Oh,
And
wow.
he called me up and I said, "Listen, uh, they did the right thing, and you need to, do whatever you need to do to
So,
try to get
well,
that down."
that's the one, it's the systolic and the what so the what systolic and so the top because my top number was 187, but the other one was 74
Ex-
or whatever, so they were
Right.
fine with it.
Right.
They're okay.
Right. So,
Or you just like, you just wanna do the surgery now
I
and
know,
yeah,
just get
right.
it over
Just
with.
get it over
oh my
with, and
god,
then
my
my
good
blood
Yeah.
pressure will
but
drop
yeah,
afterwards, right? Yeah.
but I
Yeah,
guess I was
Uh,
we
alright.
used to think that, Arlene, that, we worried more about that second number, which is the diastolic blood pressure, which is really a reflection of what the pressure that the heart is pumping against at rest, right? And so we worry about that. We worry about both numbers really, because systolic is what's happening when the heart is in systole or contraction, and the diastolic is when the heart is in relaxation. And both of those elevations are not good. We used to years ago
mm,
worry more about the second one,
What I
thinking,
always
well,
I always
if
say,
the right, if the left side of the heart is pumping against a high pressure when it's even in the state of relaxation, then really this is a risk factor for, enlarged heart failure. And that's still true, but we really worry about both. So I think right now, most experts agree that, a resting blood pressure of 120 over 80 is that's it. Anything less than that is normal. At least that's what the American Heart Association says.
but then you
And
have oh, I'm sorry, then you also have to look at your pulse rate, the number that's underneath that, right?
well, I mean, it's the pulse is a little tricky because the pulse rate is important, but so many things can affect that. And by the way, that's why I also advise checking your blood pressure in your own environment the same time every day, because things, even like a cup of coffee, can affect your heart rate or your blood pressure, right? Medications can affect it. A phone call that you got from somebody you didn't want to speak to, right? Or missing a deadline. So
This
it's
affects
good to,
me, my mouth. When I
yeah,
talk, I get hy I'm a hyper person. I get really I get excited. I
yeah.
like people I talk, and then my blood pressure
oh
Right.
my gosh.
So I think the most important thing to look at are patterns, not isolated periods where your heart rate or your blood pressure may go up. That happens to
Um,
all of us on any given day, and we're oblivious to it, right? So the important thing is to watch for patterns. Unless, of course, your pulse is extremely high and you're having symptoms, or your blood pressure is really high. But the thing about blood pressure is it's got to be really, really high for you to have symptoms. That's one of the reasons that we call it
this
the silent killer. Right. You've
what
heard
are you
that term.
calling high, Deb? When you say it's gotta
So,
be really high?
okay, I'm glad you asked. So, the American Heart Association considers anything now to be elevated, anything between 120 and 129 over 80. Okay,
That's
so that
high?
that has that I mean, not very high, but elevated, okay? And that has increased over the years, okay? Well, that has decreased over the years. It used to be, oh, 140 over 80, we're not gonna worry. That's anything that is 130 to 139 over 80 to 89 is considered higher, and stage 1 hypertension. Stage 2 is 140 over a 90. So that's stage 2. But
Mhm.
now in heart health, we really want to treat people long before they get anywhere near that. That's the most important thing. And regular exercise, Joanne, you asked about risk factors. So certainly weight, weight management, regular exercise, stress management, all of these things activate what's called the parasympathetic nervous system. Like we all live in the fight or flight sympathetic nervous system, right? Which is the part of the nervous system that gets us going in the morning, gets our heart rate up, gets our blood pressure up. And that's a good thing, right? We have to function. But we can't live there 24/7, right? We have to get into that state of relaxation. So, again, blood pressure being the leading cause of stroke in women, I really can't stress it enough, especially because it's controllable. Even if you have a genetic, uh, predisposition to having hypertension, it does not mean you cannot control it and you can't prevent things like stroke. Okay, you can control. We have to focus as women on what we can control. As we used to say when I was in clinical practice, genes may load the gun, but the environment pulls the trigger. And that's not even an analogy I like to use in today's world with my feelings about guns and the problem that we have in this country. But I think the notion is that genes will set you up perhaps for a problem, right? But
Mhm.
what really pulls the trigger or sets it in motion or lets it manifest is the environment. And we do have control over that, over big pieces. Did that answer your question, Joanne?
That did, thank you, and I was just curious, like, sugar, does sugar affect that too?
Well, blood sugar, I think, certainly is extremely important because it can cause, especially in this country now, we have a younger and younger and younger, more and more adolescents, young children having high blood sugars due to obesity. So they're at risk for type 2 diabetes. And certainly, type 2 diabetes is a risk factor for cardiovascular disease. So a high blood sugar in itself may not link to cardiovascular disease, but it's kind of a part of that progression. So yes.
Okay, Deb, I want to ask you, because we've talked about women, but this amazes me because I didn't think about that this much until we started investigating and you shared information. Cardiovascular disease in children, and that,
Wow.
mothers, children, caregivers, teachers need to be aware of
Yes.
in kids that you would never even, think about.
I would have never thought about kids.
Other than
Right.
having a child that's born with a defect that you would be aware,
Absolutely.
but you're talking about just everyday child that
Yes.
okay,
Yes.
so
Yeah. Thank you for asking.
what would you
Um,
be aware of? I mean,
yeah.
but
So
Esther, maybe if they're what, always tired a lot?
So, the thing that you're right. What I think as mothers, and as I certainly know in my nursing practice, but just as mothers, we think of children that are born, as you say, with heart defects. So they're known to have
Mhm.
it. And, we know right away, okay, this is on our radar and we have to deal with whatever the treatment is, risk factors, etc. But many children are born with an undiagnosed rhythm disturbance. Okay. And I've done some work with an organization called the Sudden Arrhythmia Death Association, or it stands for Sudden Arrhythmia Death Syndrome, where children have, for example, a common one is called a long QT syndrome. The child may be perfectly healthy and have this and never be in an environmental situation of stress that may cause the heart to stop. But you hear these stories about kids who are playing soccer or football, right? And they're on the athletic field and they faint, and everybody thinks, oh, gee, step back, give them air. They're just dehydrated, if they're too hot. Um, that may be the case. They may be dehydrated and they may have exertional fatigue, but they also may be having an arrhythmia, which can be fatal. And it doesn't always mean they have a genetic problem like long QT or others like Wolf Parkinson White, but they may have a near fatal or a malignant rhythm disturbance because they're dehydrated, or if they're teenagers, they're on a crazy diet or they're using drugs of abuse. I mean, drugs of abuse can cause problems with heart rhythm, either a primary or secondary cause, things that parents may not be aware of. And so this is one of the reasons I feel really strongly about AED awareness that I'm going to cover in a minute. Um, that we should have AED access, and the American Heart Association feels strongly about this. Certainly, the Sudden Cardiac Arrest Foundation and Association, so that any of our children are not out on an athletic field where they pass out and everybody's kind of standing over them and saying, "Step back, give them air," and there's no AED.
Mm.
When, this is a 3-pound piece of equipment that can save your child's life, and we'll figure out why it happened later.
So, let me
W
check something. So if a child's on a field and they pass out, I mean, wouldn't somebody have to be there to take their pulse, see if they're breathing before
a
you paddle? So,
absolutely,
you don't
somebody the
paddle
pu
if they pass out.
no, 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 but they should no,
Well, you know me, I could be hyper.
that
I
that's
just
okay. Yeah, no, no, but
Oh
I
my God.
think certainly to have what I call heart awareness,
yes.
Mm.
which is something that we had in my personal home, which is what saved my life, only because I felt strongly about it. For other people in my home, my husband who has cardiovascular disease, my father who lived with us at the time, never did I think
Would be used on you. Uh-huh.
as a woman
Right.
that and as a nurse that what I taught my family members, right? CPR and use of an AED would be used to save my life. Right? So you've heard that expression, the life you save may be your own.
Right.
Well, case in point.
Wow.
Right.
So
That's
yes,
something for yeah.
You
the
know,
coach, other lead players, everybody should be trained in CPR and how to recognize when an AED is appropriate, but it certainly should be there. And the first thing is to activate the emergency medical system. So somebody passes out, shouldn't be standing around trying to figure out what's going on immediately if the person does not regain consciousness. Coaches are trained in this, but people panic. They
right.
truly oh, give him a minute. He'll
Yeah.
come around, you know. The
Mhm.
recent incident that we had, I think it was Hamlin. So he was a safety for the Buffalo Bills and he had the cardiac arrest on the field.
Oh, yeah. Yeah.
Right. So he had another thing that links to your question, Arlene, is something called commodio cordis. Very rare, but this is when an athlete, often a football player, but it could be an lacrosse player, right, or a hockey player, has a blunt trauma to the chest, which is what happened to him and it hits the heart, it hits the chest wall at a very vulnerable time in the cardiac cycle, and it
Oh,
causes
wow.
an immediate cardiac arrest. And
That's scary.
that's what happened to him.
Wow.
And that can happen to athletes. And so there's just no excuse to not to have that. And we need to really raise money, uh, have fundraisers, whatever we need to do to have those things,
Mhm.
accessible to our children.
You know, Deb, what's scary, and I'm thinking about
Hamlin.
my
Excuse me, I found his
brother-in-law.
name, Damar Hamlin,
uh,
right. Sorry. Uh,
I was thinking about my brother-in-law's brother, who was very healthy athlete, basketball coach, and he went in for his just regular annual physical. He was given a clean bill of health, and he walks outside of the doctor's office and drops dead on the sidewalk. They didn't realize that of all the 15 siblings, yes, 15 siblings, they all
Wow.
they all had a cardiac defect that no one caught until,
Mhm.
this young man died in, like, he was, like, 38.
Was
So,
was it an arrhythmia,
I
Joanne? Do you
don't know
know?
what it was, quite honestly,
Mhm.
but the scary thing is we go for physicals every year, And we don't
Absolutely.
have detailed heart exams if there was,
Mm.
something wrong. Um, so it's like, wow, how do you know? I mean,
Yeah.
you just can't go into a doctor's office and says, "Hey, you know what? My friend died of this," so they won't give you those
Yeah.
tests.
Well, that is a great question, and it gives me an opportunity to talk about some of the myths that we think. There are many,
Mhm.
but I chose 3 for today, and they
Yeah.
relate to your question. The first one is, I'm too young to have heart disease.
Right.
No, I mean, that happens to older people, it happened to my mom or my grandma. Absolutely untrue. As we just talked about, it can happen to anybody of any age, particularly if it's a rhythm disturbance.
Mm.
And so, and blood pressures also play a role in that. The second one is, well, I would know I had heart disease, and this sounds like is what happened to your
Yeah.
relative. I would know I have it because I would have symptoms. Untrue.
No symptoms. Yeah.
Untrue. You might have symptoms. And this
Mm.
brings me to an important point that I'll just mention very briefly. I'm going to come back to it. But if you are having concerning symptoms that you think, well, I'm not so sure, don't be quick to dismiss them either.
Mhm.
Like, for women, what we know, and there's been a lot of studies on this, women with, for example, cardiac ischemic disease or blockages through the arteries that feed the heart muscle,
Mhm.
if they're starting to evolve or have a heart attack or have something that leads to a heart attack, their symptoms may be very different than that of a man,
Right.
right? They may not always have crushing chest pain, the typical, radiating to the left arm and the left jaw. Women may have some subtle pressure. They may have pain in their back. We know that they may have GI disturbances and that often they can go to an emergency room and say, I just feel really tired.
Mhm.
And I know I have this kind of strange feeling in my back, and I don't know, I'm stressed at work, and they are dismissed, often dismissed. So we're much better now at not dismissing that, but I think it's important for women to know that depending on the provider they're in front of,
Mhm.
they need to insist. If they are feeling something's wrong, follow that intuition.
Wow.
And yeah,
Yeah.
and the third I wanted to mention is that, particularly with a heart attack, I'll know I'm having one because it's not subtle. I'll have this will happen. I'll have crushing chest pain. I'll have, in a perfect world, I'll have time to call the ambulance,
Mhm.
911. The first symptom that many people have for a heart attack, or in the case of your relative, maybe a heart arrhythmia, is sudden death. Think about that. The first symptom that many people have is sudden death.
Wow.
Now, I'm watching your face, Arlene, and this is a sobering conversation, and I don't mean to be
Bye,
Nurse
guys.
Ratched.
I'm leaving. I'll go to the doctor's.
Bye.
I feel all these things.
I
Our
know.
blood pressure just went up, right, Our?
Right. So, but I think the good news is, if you know that if you information is power, right?
Right.
Knowledge is power. That's why you're here. That's why you have this wonderful podcast. And so we hope the worst doesn't happen, right? But the good news is that so much of this is preventable and controllable if you just know what it is.
And other
And
parts
if
too, with everything considered, still life is a mystery and you don't know. Because I was just listening to somebody, because the big thing they say, and this is for everybody to do, and I haven't done it, that calcium check, the heart cath that you do, heart
calcium scores,
the
right?
CAT
Something
scan you
sweet.
Mhm.
do for the heart.
CAT scan for a calcium score,
And
right?
I was just listening to a cardiologist on that one saying, you know what? Even if you have 0, doesn't mean you're free. So there you
Oh,
go.
wow.
So a lot of people go in, they
Right.
go, "I have a 0." So,
Right.
um,
Right.
that's not
So that's a
necessarily
great segue,
Wow.
and I am really glad that you mentioned it. The reason I'm glad you mentioned it is because mine is 0. Mine was 0 when I
Oh,
had a
wow.
full cardiac
so there
arrest,
you go, folks.
There
okay?
Yep.
you go. Yeah.
Right? So I was not hypertensive. I did not have any of the traditional risk factors that we talked about when you asked your question, Joanne. However, I had a tsunami of stress going on in my life, right? I was caring for everybody but myself. I had just gone for a physical, and my doctor looked at me and he said, Deb, the numbers look great, but you don't look so good, right? You don't look so good. And I thought, oh, well, I'm just tired. I need to get more rest. And I was also deeply grieving. So we also know
Um,
grief,
okay.
stress is, certainly the large overarching, category, but grief in particular, loss and grief really stress the cardiovascular system. And I was deeply grieving the loss of my father. So it was not one thing, it was a combination of things. And looking back on it, I certainly can't control my father passing or my grief response, but I certainly could have managed my stress a lot better than I was. And I certainly could have taken care of myself better. Would it have happened? I don't know. But looking back on it now, I sure would have liked the opportunity to have prevented it.
It's
So,
also
Sure.
known, the phrase has been out there for a while. They coined it the broken heart syndrome,
The
which
broken
I think
heart.
I think for women that it was always referred to more for women than anything with men. But
Right.
when you're
Mm.
when you're like you said, highly stressed or grieving a love, you know,
yes.
doing relationship, they just keep talking about they incessantly run it and they can't get over it.
Right. I
That's
often wonder how many MDs actually or look at that, the emotions that are out of balance.
Yeah. And, Joanne, that is such an incredible, just an incredibly good point because I think any provider, whether they're an MD, nurse practitioner, an integrative provider, whoever they are, the most important thing is to look at the whole patient, right? What's
right.
happening in, the mind, body, and spirit. We're not just, a right and left ventricle and, I mean, we are holistic beings. And what's happening in our emotional life, right, in our psychological life impacts the heart in a
Mm,
big, big way. And I think it's so important for women to know their bodies, again, know what their baselines are. And I'll tell you a quick story because I'm so, im- you know, big on advocacy. Uh, I in my before my event, I was seeing a provider who is not my current provider, so I want to be clear about that. Who, by the way, is I think the world of, and I have the highest respect for him. But at the time, I was seeing a provider, and I was having, when I look back on it, some prodromal symptoms or symptoms that were leading up to what in my life was a big cardiac event. I was having some dizziness, I couldn't put my finger on it. I was tired a lot. I was having some palpitations. And none of these things were measurable when I was in the office. Everything was normal. Everything looked fine. And I remember the exact words by the provider. He looked directly at me and he said, "Well, you know, you have a lot of stress, and I don't really know what these symptoms are about, but I'm 100% sure it's not your heart." It was my heart, okay? And it was my
Mm.
at least it was my cardiovascular system telling me, "Hey, something is not right." And, you know, then I would go periods of time and not have any symptoms, which is typical of rhythm problems, which is what happened with me. So I really learned a lot about advocacy in that moment because I thought, well, this is a person that is highly regarded in the community, the medical community. I had the highest respect for him. So you know what? Maybe I'm overreacting a little bit. And I minimized and doubted my own intuition. Never do that.
Never do that.
Never do that.
Wow.
never do that. The worst that could happen is you go for a second or a third opinion and somebody tells you, "Hey, listen, you're imagining it." Well,
Right.
that's run for the hills when you hear that. You hear
Right.
that. So,
I have to share some of these statistics because I was doing some research, this week on this.
great.
I
Great.
I was blown away at these figures, guys. 931,578 deaths in the United States happened in 2021 because of cardiovascular disease. And then it jumped to 2022 to almost 950,000. And now they're projecting for 2050, the year 2050. Are you ready for
Mhm.
this? 180 million. I mean,
Yeah.
that's staggering.
It is.
Staggering. So,
It
can
is.
you talk about the importance of CPR?
A
Uh,
absolutely, and I'm
wow.
so glad that you brought that up, and, of course, that lump that's a big category, right? We talked about that in the beginning.
Yeah.
So, it doesn't just mean a heart attack or cardiac arrest, it's kind of all cardiovascular disease deaths combined.
Mhm.
But, the important thing when you ask me to talk about CPR is that in this country, every year, uh I think most references now will say anywhere between about 375 and 400,000. So almost a half a million people die needlessly
Right.
from cardiac arrest. Okay. Now, side point, there's a difference, and not everybody, but many people think cardiac arrest is a heart attack. It's not. Okay. An important difference is that a heart attack is basically a plumbing problem, right? So the heart is not getting fed through the coronary arteries with enough oxygenated blood, and the muscle itself is impacted. It becomes, it's angry. It wants oxygen and it part of it dies, and that's called a heart attack. And scar tissue forms there. Cardiac arrest is just an electrical event, and in my case, that's what I had with a calcium score of 0, no coronary arteries, right? Coronary artery disease. When they did my cardiac cath afterwards, they said, "Well, Deb, you're 54," which I was at the time. "You have the coronary arteries of a 30-year-old." So
Wow.
they could have cathed me the night before and said, "Well, no risk.
Yeah.
No risk for heart attack," but I certainly was at risk for um cardiac arrest for a number of reasons. So, I'm going to have a little show and tell here. Okay. So, the first thing I want to say is that right now, as we speak, anybody can, and of course, February is Heart Awareness Month. Okay. Go red for women. And the site is go red for women.org, right? Look at Arlene's beautiful sweater. My earrings. I have my little red, you can buy these from the American Heart Association, my little red, dress here.
Red has
Um
hearts on her blouse, even though you can't see them.
You can't see
Oh,
them, but they're
okay.
there.
Uh,
There's just
oh,
hearts
they're
on
there,
it.
I can see, they're great. But we think of CPR as, okay, I've gotta get CPR certified. I've gotta go down to the high fire department. I've gotta get certified. You That would be wonderful. But it's a Cadillac. You don't have to get certified. You just have to learn CPR.
Okay.
I taught everybody in my house CPR. Nobody was certified. The one that saved my life, the beginning of it, was my husband, right, who I taught. He was not certified. He's not a healthcare professional, right? So right now, as we speak, so I'm going to start my show and tell. And I don't know if you can see this. It's called CPR Anytime, and you can purchase this from the American Heart Association. I'm going to have links at the end that
Yeah.
you for your viewers. This is $49. Okay, $49. Okay, not a lot of money. This is what you get inside. Okay, you get. First thing I'm going to show you, we talked about AEDs, or automated external defibrillators. You see them in airports, you see them in sports clubs. easy to use. A Boy Scout could use them. The machine talks to you, it tells you what to do. You can't hurt anybody with the machine. If the AED will not deliver a electric shock that through the chest wall into the heart that can save the person's life, it'll say no shock indicated. So it knows, okay? It also will talk you through CPR. And in the kit, okay, your $49 investment, okay? You get, and this is just a mock-up to show you that it will, and it comes, by the way, when you pay the $49, it comes with a downloadable course from the American Heart Association and an interactive app to put on your phone that teaches you, how to use an AED, what to look for, where to look for one in the public, if you're in the public place.
I just want to interject something just for our audience and listeners to hear. That what it says AED is not the machine. It's just telling.
No, no, no. Yeah.
Well,
Right.
so somebody's
Thank
gonna
you.
think
No, thank you
somebody's
so
gonna
much. Yeah.
think for $49 they're getting an AED. No, folks, that's not it.
No, I'm getting to that.
For
I'm getting to that. No, this is
CPR.
just so it is not the machine. No. Oh, very important. It's just for you to see what the face of one might look like. Okay. And then it shows you, or the cover of one, let's see if we can see these.
It's hard to see.
Okay. What the pads look like and where you place them, and they peel off. Okay. I'm going to see if I can. Um, this is newly purchased for today. So, but they peel off so you can practice where to put them on the chest. So you can do this in front of your computer, right? In the privacy of your own home. Okay. Where to put it on and what basically the front of one might look like. Very basic. Okay. I'll talk about AED purchases in a minute. The other thing you get, if anybody is watching this that's been certified or is certified in CPR, and you remember the big mannequins we used to use
Yeah.
called, we used to call them Annie, we Sussy
Right.
Annie. Okay, so this is what you get. Okay, so I'm gonna hold it
Huh.
sideways, right?
So she looks like
No,
she's
this
in
is yeah,
bad shape.
right. So I am. This is
Oh my god.
I like that long
sorry.
neck.
No, this is right. So, but this is what you use at home with the program. It's all one. You pay your $49, and the program comes with it. And it I've inflated it so it doesn't look as horrible as it did when I took it out of the bag, right? But you can see it shows where you place your hands on the sternum to do
Okay.
CPR. The program talks you through how to extend the airway, how to open the airway, how to save an adult and a child from choking. There's also a separate infant child, if
Okay.
you infant program rather, if you want to, if you're a new parent. And I advise all new parents, even if their baby is healthy and happy and as adorable as can be, learn CPR, particularly airway. Most children that have cardiac arrest or cardiac events have respiratory events first. That's right. So they choke on a toy, they aspirate food. Okay. So a really big investment. Okay. I don't know what I'm going to
Mm.
name him or her yet, but he doesn't look like an Annie to me, or she doesn't look like an
Joanne.
Annie. I'm not so sure. Okay.
Joanne Early.
So,
Joanne.
and in the bag will also be, and you see the American Heart logo. This will be at the end if you can't read it, but there's a code here that shows you how to log on to the site and to access the course.
Okay.
And there's a smart code here. So there is no excuse anymore for any of us not to learn CPR, especially if you're intimidated by going into a class. You can learn
Nope.
it at home. And AEDs. And Arlene made the point. This is not the AED. Okay, so good
Thank you.
point. So
Tell everybody what AED
yes,
stands for.
yes.
What does AED stand for?
So automated external defibrillator,
Mhm.
which is a machine that generates a shock that penetrates the chest wall. And in certain rhythm disturbances like ventricular fibrillation, which is what happened to me, it can stop that rhythm so that the heart can start beating in a normal rhythm. And what we know about high quality CPR and AED use is that for every minute that passes after somebody, child, loved one, adult, male, female, is in cardiac arrest with a shockable rhythm, which the machine will tell you. You don't have to figure it out.
Mm.
No degrees necessary. The machine knows it all, knows enough anyway, I'll say that.
Mhm.
For every minute that passes, the person's chances of not surviving that event or surviving with irreversible brain damage go up substantially. So,
Deb,
yeah.
given such a wealth, I hate to rush, but, we're timely, and,
Mm.
we'll probably have to bring you back to continue on, and just share some more in that. We're going to have links to everything below, and do you have, like, one place more than another to get an AED?
Well, the only AED that I'm aware of that has FDA approval for home use is the Philips Heart Start,
Books.
and it averages. I'll include the link. You can get it from a number of different vendors, but that's the only one I'm aware of that has home FDA approval. It's about $1,200. And maybe 1,400. There are places you can get grants. Some insurances will pay for all or part of it,
Mhm.
depending on your medical situation.
Mm.
But when you think about what we pay for a laptop or a big screen
Oh, this is
TV, right? Or a vacation,
Hey,
$1,200
folks,
is that can
this is
save your
so,
life.
so important. And it doesn't mean if you're
Right.
living in a rural area out in the woods, that's gonna take forever because you know what? Nowadays, it takes forever for an ambulance to get to you.
Exactly.
They
Well,
call the fire department first,
absolutely.
but I mean, this is very, very critical and very important. And the other thing, if you can't afford the AED, is really to get that packet for the $49. What an I mean, everybody. I mean, I'm
Yes,
getting it. I'm
yes.
gonna
And
get it for
and I
family
will
members.
say also that there are refurbished AEDs that you can get for about half of that price that are checks. I know, I know.
Well, you're like, "Oh,
Depending on
oh,
the
Betty,
vendor,
I'm gonna work
I'm
on it."
I'm not I'm not recommending any products. I'm just giving you the
Hold my
information, and they're
martini.
checked by engineers and this, but really that may be a lot of money for somebody,
Mhm.
and for somebody who is living with somebody who has heart disease, and say we're in the middle of another pandemic, right? Or has risk factors and doesn't have diagnosed heart disease. We talked about
Oh, where
that.
could somebody purchase that packet? Can you go I mean, can you get through Amazon?
Oh, yeah,
Get
you
through
can
Amazon?
you can get this right on the site here. I'll include it at the end, but it's heart.org, and it's called CPR Anytime.
Okay.
CPR anytime.
Heart.org, CPR
Hey,
Anytime.
everybody, we're gonna have there's gonna be a lot of information because there's other great information. Deb had
Right.
little videos that we didn't have enough time to put in, but we're gonna link it
Yes.
below. So really click on there and watch these because it's a plethora of information. But as Deb said, and we agree also, knowledge as well. You
Exactly.
oh, you
Absolutely.
could save
Yeah.
people's lives. I used it with my first mother-in-law. This is back in the '70s. My ex, he was a fireman. Talking to her, we were sitting around there, and she just went like this, and she shot a blood clot, and we screamed. My son was an infant, and he started doing we were doing CPR on her, and the cardiologist 'cause back then, nobody knew about all no one talked about it. He wanted to do an article in the paper and write it up that people should know, but we know she didn't wanna do that. Anyways, thank you, Doc
Yes.
Deborah King. Thank you so much for the
You're
Thank
welcome.
you.
You're welcome.
and
The biggest thanks you could give me would be that anybody watching
hey,
this,
if we get one
um,
person saves I mean,
one person, right,
Exactly.
but that they're aware of things that perhaps they weren't aware of before, and that they, hey, $49, I mean, how much is a Starbucks these days, right?
that's
I
right,
mean,
that's right.
skip Starbucks for a week and you've got it,
There you
I
right?
go.
would like I
So,
would like
sorry, Starbucks. Sorry about that. I'm a Starbucks fan, so sorry.
I'd like
But
everybody also to know that Dr. King is also coming back. This is the second time she's been on Beacons of Balance.
Mhm.
Please look up on our go into our archive videos. If you have to actually go on your computer. So if you're listening through a podcast or you're watching it on your smart TV, please type in Beacons of Balance, and in there you hit watch now, and it has all archived our videos. And Dr. Deborah King was on last year, March 13th, and the episode was called Beyond the Veil. You'll learn about
Mhm.
Deborah's journey and about her wonderful near death. Well, it wasn't wonderful to you, but it's quite an amazing. I don't know if you,
Well,
it was an
the experience
amazing.
is pretty wonderful for me, not for my family,
It
but
was an amazing,
Um,
yeah, near-death experience that she went through and everything. You could find out
right.
that, and,
right.
Joanne, what else would you
Thank
like
you.
to share?
I just wanna say, hey, it's 2025. Make this a year of transformation. Make some changes, guys. Healthy
A
changes.
absolutely.
You deserve it.
Health is
Yes,
wealth.
you
You know
do,
You
what?
you
deserve
do.
it.
Health is wealth. You can't do anything,
Exactly.
Yep.
if you don't have your health as primary. So,
We have to put the oxygen mask on ourselves first,
Exactly.
right?
Take
and
care of you.
and Dr. Debbie gave us some wealth of information here, some really gems, gold nuggets.
Yes. Thank you. Thank you.
Also, I wanted to interject, this isn't out yet, well, it's out. You could get it
Uh,
it's not on Amazon yet. A
uh,
book
okay.
that,
That's amazing.
Thank you.
here's
Yeah.
about
Beautiful.
children's
Just
app,
beautiful.
about being
Wow.
aware. It's just a beautiful,
Wow.
Right.
beautiful book.
This is a book about my near-death experience, but it's for children,
It's
and it's,
Wow.
but it's also for
was ver
adults. It gave me
oh,
chills
it
and I
is.
cried because
Yeah.
Brinkley is a story. It's so right to the heart. It is right to the heart. It's really,
Mhm.
thank you so much.
Thank you.
You're
Thank
welcome. Thank you
you.
for having
We're gonna
me.
have you
Thank
on
you. I
again.
wish
We're
everybody
gonna have
health
you on
and
again. But
happiness.
I
Yeah.
please, everybody, would you please subscribe? It doesn't cost anything because we're people, does this cost? No, it doesn't cost anything. We wanna grow. We don't wanna grow this way. We wanna grow our channel.
Unfortunately.
Please subscribe. You
Right.
have to
Yes.
subscribe. You have to please like it and leave a comment. Let us know what you think, any
Right.
experiences or whatever, because we love
And
it.
share.
Yes.
Share these
Mm.
And we'll
episodes.
respond back to you, and we'd like to have that communication because we wanna grow this. Because we have some good things coming up to share with you. And this was $1,000,000 episode, I believe.
Oh, well, it will be worth $1,000,000 if it saves one life, right?
I'm sure it will. I'm sure it will.
One life. Yeah.
All
So,
right. Well,
yeah,
thank
please
you
check out the
all.
links. Yeah. Thank
Thank
you
you,
for having me.
Arlene.
Have a great day. Stay in balance,
Stay in
everybody.
Yes,
balance.
stay in
Yes.
balance, and you
Right.
matter.
Right.
Remember that.
Yes,
Remember to be the beautiful
you
beacons
do.
of light that you are and shine it out there and connect with
Right.
everybody. Do not divide. We need to be united
Right.
no matter what. Love you guys. Till next time. Every
Okay.
Wednesday, 11 o'clock.
Yes.
Bye.
Bye-bye.
Bye.